Hey guys, Nate here. So I wanted to talk to you about low back pain and how you may be able to fix it on your own, or what a clinician should be looking at to, if you go see somebody, that they should be making sure they check all the boxes to make sure that they are putting you in the right bucket and giving you what you need to fix your low back pain. So when I see somebody in clinic or when I'm working and treating somebody, there's usually four categories that I put somebody into like four buckets of low back pain. So the four buckets would be a manipulation group, a stabilization group, a movement direction group, so a specific movement direction, and a general movement uh, bucket. So when I'm evaluating somebody, I'm placing them into these buckets so that they get what they need. All right. So what the manipulation group would be. So there's five different things that I would that I look at for five different tests. And if somebody fits more than three, so if they have four or five of these things that they are positive for, I would say that they might need a manipulation. So that would be like what most people would think of like a pop in their low back. The five things that I would look for is, do they have hip internal rotation that's greater than 35 degrees? So does their hip rotate more than 35 degrees, and at least on one side of their hips? One of their hips can do that. Do they have no radiation of pain past their knee? So if they have radiation past their knee, so if you have numbness, tingling, or pain past your knee, you probably don't fit this category. Do you have a hypomobile segment when I am pressing on your back? So if I get behind your back and I'm kind of pressing on your back, does one of those segments on your low back, does it feel a little stiff or sticky? If it does, then that would be one of the categories of positive finding for a manipulation. The other one would be, there's a fear avoidance. So are you afraid of movement is actually a category. If somebody is kind of fearful of movement, they're probably not going to respond to manipulation or a pop because they're a little bit more afraid to to get that high intensity kind of thrust is what it's called, to get that pop. And then the last one, is it less than 16 days old? So if it's less than 16 days old, or if it's longer than 16 days since you've had low back pain, chances are manipulation may or may not help. It's just not as reliable as if it is going to help. So for that category, if you fit in that one of those, you have four of the five of those positive findings. Stabilization. So this one has four tests that I look at to see if you fit in it. The first one's pretty easy. Are you under 40? Most of the time, if you're over 40, then you start developing stiffness and not necessarily a stability factor. So if you're under 40, that's already a positive finding. Do you have a straight leg raise over 90? So if I lay you down on your back and you lift one leg up, can it go past 90 degrees? If you can, that's a positive finding as well. The other one is, it's called aberrant movement with the toe touch. What that means is, when you bend down, touch your toes, do you have to crawl yourself back up, or do you get kind of a hitch in your back where it's just almost like a sticking point before you have to go down? If you have one of those, that's almost more of like a stability factor than it is a mobility issue. So that would be a positive finding for a stability test. And then the other one is a very specific test that I would do. It's called a prone instability test. And all that is you're laying on your stomach with your feet hanging off the table and your feet are on the ground. I'm going to push on your back on a few segments on your low back. And if there's pain, I stay on that segment and you lift your feet up off the ground about 2 inches. And if I press on that segment again, does it take away the pain? So the reason why that works is because if your legs are on the ground and I'm pushing on it and I'm creating a little pain, you actually kind of give a gross stability when you lift your legs up and that pain is gone. So that's telling me there's a little bit of stability. So for stabilization category, 3 of the 4 need to be positive on that. Okay? For the movement direction specific, so specific movement direction, I am looking more at, this is kind of what your history is telling me. This seems a little bit more nerve related. So direction specific means, does bending forward or flexion help relieve the symptoms, or does bending back relieve the symptoms? These are the people that kind of have pain down their legs. This is a lot of times past their knee, and it kind of seems to come on. That pain kind of gets worse whether they're long duration sitting or long duration standing, tends to make it worse. So with these types of guys, these are the type of people that I'm very specific on, and I may have to see them in clinic to be able to pinpoint where they're at. But a lot of times, bending forward a lot, like so knees to chest or touching their toes, may alleviate, or might make worse. Or bending backwards, so you're on your stomach and pressing up, your shoulders off the ground, tend to help. And by help, what I mean is it typically takes pain away from takes pain further away from your feet and bring it closer to your back. So these are the type of people that I really would like to see, that I would really like to see in clinic, and be really hard to give suggestions without knowing exactly where they're at. For the general movement population, so these are the people that don't necessarily fit any of the other categories, but when I look at them, when I assess them, their hip rotation may be a little limited, their hip extension may be limited, their upper back may be a little limited. These are the guys that their general movement patterns don't necessarily fall in line with what you would expect they should be able to. So a lot of times for these guys, I am fixing a lot of their movement patterns and then getting them on exercise programs to get them adapt and get them to move in proper sequencing, so that their back's not taking a toll and you're actually loading your hip or your upper back instead of your low back, so your low back's not taking a lot of stresses. Okay? So one thing to know, like I've given some of the positive findings, especially for the manipulation and the stabilization, where there needs to be 4 out of the 5 for manipulation, 3 out of 4 for stabilization. What you'll notice is a lot of people don't necessarily fit one of these categories. So that's when it starts to be a little bit of gray, and you start kind of combining some of them. So somebody might have 2 of the 4 stabilization and 3 of the 4 manipulation. So how does that help? Where does that lie? So that's when you start having to blend a little bit, and it's not 100% of exactly what you should do, or what direction you need to go into. So there's a lot of times I'm kind of blending. A lot of times the general movement, the movement patterns will go into all the other categories as well, or the stabilization category might go in the movement, specific movement direction category. So some of these may blend, but knowing which category you fit into goes a long way to help you get where you need to be. So if you're seeing somebody, make sure that they're looking at these different categories and these different buckets, so that you're getting served the best way possible. Okay? If you guys have any questions, feel free to reach out to me. Hope this helps. Thanks, guys.